Welcome to the Wow MD podcast, where in each episode, you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Cernăianu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello there. I'd like to start this episode by expressing my gratitude for your time and for the fact that you've been chiming in week after week, sometimes just a few episodes depending on what your goals are and what you're looking for. But today's episode is about men. And we are in June, and I'm releasing a small series of episodes in the month of June because we celebrate Father's Day each year in June, the month after Mother's Day, which is May. So in honor of Father's Day, I chose to do just a few episodes on men's health and address the topics that are at the top of mind, or if they're not, they should be at the top of mind for all us women and for our men. I'd like to talk about different things that impact a man's health, and that is very important. A man's body is extremely different than a woman's body. We do have some similarities. For example, some of our hormones like insulin, thyroid, aldosterone, cortisol are not at all that different than a woman, right? They're all the same between a man and a woman. They're not that different to a magnitude where they will do something completely different, like testosterone in women is different than testosterone in men. But there are some very unique issues that impact men's health. And honestly, I will only scratch the surface with the few that I picked, but let me dive into some of the details that I want to talk about. Let me start with why am I talking about men's health instead of simply just focusing on women's health? I am an OBGYN, right? That is correct. I'm not an internal medicine doctor. I am above all else a women's health specialist, if there is such a thing, there should be. But after my conventional training as an OBGYN and after my father's passing, when I decided to get trained in anti-aging and regenerative medicine, simply to apply this knowledge to my mother, my aging mother, who was 72 at the time, in the process of getting board certified through A4M into the anti-aging and regenerative medicine, I learned a lot about men's health. At the beginning, I was like, okay, well, there's a lot of useless information. What am I going to do with this? But I continued to participate in a lot of courses with A4M, even after I became board certified in anti-aging medicine in 2012, because studying for the board simply got me more thirsty for additional knowledge. So I went ahead and enrolled in the fellowship for the anti-aging restorative medicine with A4M, which took me about 1.5 to 2 years to complete. So I opened the Hera Healthcare practice as a routine private practice of OBGYN with a holistic approach. I focused a lot on hormones, but I practiced functional and integrative medicine thanks to my training, and I applied that to a lot of my women clients. And before not long, a lot of the women that I helped referred other women, but they also started to ask me, would I see their men? So even though at my previous clinical experience at the community healthcare clinic, I did not see men, I felt very comfortable after my primary care training during residency and after my A4M training to accept male patients. So I said to my patient who first asked that question, I said, sure, bring him in. I'll do an evaluation. I'll make a recommendation. What will be best, in my opinion, to help your husband? And it grew from that. In the past 10 years, I've seen more and more men because more and more women are happy with our services and recommend their husbands, their sons, or their fathers and grandfathers to come in and see us. And recently, I hired, in the past 3 to 4 years, family nurse practitioners. And my most recent family nurse practitioner, Barbara Lee, has a very long background in primary care, and she specializes in men's health. She loves men's health. So I know I talk a lot about women's bodies, women's hormones, and women's health, and maybe You expect me to talk about men's health from the perspective of men's hormones and testosterone because I do a lot of that. But I'm not going to do that in this episode because low testosterone does not kill our men. It will impact their health to the point where there will be dysfunction, loss of optimization, fatigue, poor mental health and weight gain, which all of these will lead to disease, will definitely be some sexual wellness issues. But ultimately, low testosterone has not necessarily killed anybody directly. The top 10 killers of men are various chronic conditions that unfortunately conventional medicine has no cure for. So let's go through them one by one. And I'm not going to go all 10. I'm just going to focus on the first 5. And this podcast episode will be about number 1. Okay, it's that important. So let me just start with a few statistics. These are numbers that are very easily verified online. In the United States, heart attacks kill annually about 325,000 men. In the United States, cancer kills annually about 320,000 men. So heart attack kills more men than cancer. Ladies, if you're listening to this, please pay notice. Number 3 cause of death for men, accidents and trauma, including road injuries, car accidents. They kill about 86,000 men annually. Number 4, 60,000 men die from chronic respiratory disease, including COPD and emphysema in the United States. And number 5, annually, stroke kills 52,000 men. And just as a tidbit there, 39,000 men die from suicide. So top 5 causes of mortality among men in the United States each year are number 1, heart disease, number 2, cancer, number 3, accidents, number 4, chronic lower respiratory diseases, pneumonia will probably go in this category as well, and number 5, stroke. So let's talk about number 1 today, because this is the top killer for our men every year. And again, let's group this into cardiovascular disorders. And under this group, there is ischemia, heart attack being the pinnacle of severe ischemia, stroke, hypertension, and other little things. But these are the top 3. Obviously, hypertension is included here. It is considered the silent killer because many people have no idea that they have high blood pressure unless they check their blood pressure. Or they go to their doctor and the doctor says, hey, your blood pressure is 150/90. Oh, I have white coat anxiety. Or I'm very stressed when I come to the doctor. Or I rush to come in and I'm very agitated. You shouldn't have that high of a blood pressure. Anyway, please keep in mind, no other chronic condition is as potentially lethal for men as this cardiovascular group of disorders is. So let me ask the question that you have most probably asked yourself as well. Why do men develop heart disease above all else? Why are they so prone to heart disease? Well, let me give you the most important factors for heart disease because we know these factors. We're very aware of them. We are just not really good at preventing them or addressing them, either personally when it comes to you, the patient, or medically when it comes to the doctor. Heart disease, in a nutshell, can develop in men due to a combination of genetic, lifestyle, and environmental factors. And here are some of the key reasons why men develop heart disease. Number 1, genetic predisposition. A family history of heart disease can increase risk, and there are many issues that contribute, including genetically inherited high cholesterol. Number 2, at the forefront here, I decided it's that important, is unhealthy diet. Food is killing us slowly. Consuming high amounts of saturated fat, trans fats, cholesterol-rich foods will lead to plaque buildup in your arteries, especially in the context of inflammation. Okay? Number 3, again, that important, sedentary lifestyle. A lack of physical activity will contribute to obesity and poor cardiovascular health. Inactivity and lack of movement will create a reduced blood flow in our entire body, which will lead to poor circulation. A sedentary lifestyle can contribute to high blood pressure and an unfavorable lipid profile, which means high LDL, that's our bad cholesterol, and low LDL, which is our good cholesterol. A lack of activity will lead to insulin resistance. That is the first step on the road to diabetes. And it's also known to increase risk of cardiovascular damage, right? A sedentary lifestyle will increase inflammation, which damages the blood vessels. And sedentary people are known to have higher stress levels and more significant mental health issues, which could impact the cardiovascular risk over time. Also, the most important factor is the fact that working out and exercising regularly strengthens our heart because our heart is made almost entirely of muscle. Inactivity will lead to weakening of the heart muscle, which will make it much harder for the heart to pump blood, especially when there's an increased demand after it has been weakened by significant inactivity. That's when trouble starts happening. Number 4, smoking. I believe firmly that very few people smoke nowadays, but apparently there's still quite a few that smoke. Please be aware, especially if you're a young woman listening to this and you and your boyfriend are smoking, or you're a mom and you know that your daughter or your son are smoking, please know, or your husband is smoking, obviously, please know that tobacco damages blood vessels and increases heart rate and blood pressure. Vaping and smoking does not relax anyone. It does not help you cope with stress. On the contrary, it's literally causing physical damage and inflammation to your body, which will add to the physical stress. Number 5, very important, excessive alcohol. Drinking excessively can raise blood pressure and damage the heart muscle. Too much alcohol can cause arrhythmias, including atrial fibrillation, which can lead to stroke and other issues. Heavy drinking will weaken the heart muscle and can lead to what we call alcoholic cardiomyopathy, a disease of the heart that impairs the heart's ability to pump blood effectively. Excessive drinking means unnecessary calories, which is leading to obesity, another factor for cardiovascular disease. Too much alcohol will damage the liver, and our liver health and our heart health are intimately interconnected. An excessive intake of alcohol will also lead to widespread inflammation in the body, which unfortunately will contribute to plaque and narrowing of the arteries, leading to ischemia. And then ischemia, loss of blood flow, translates into a heart attack or a stroke. Number 6, stress. Chronic stress can lead to behaviors that increase heart disease risk, like overeating, smoking, drinking, not working out. Chronic stress that is not managed properly will increase cortisol, which will unfortunately lead to inflammation and a dysregulation of our most important hormones, including testosterone. And as you know, testosterone is a vital hormone for cardiovascular health in men. For more information on how stress is killing you slowly, please visit my episode entitled Top 10 Ways Stress is Killing Us Slowly. Number 7, obesity. Excess weight leads to hypertension, diabetes, high cholesterol, and inflammation. Those 4 things are the foundation for cardiovascular disease. Again, high blood pressure, diabetes, high cholesterol, and inflammation. Abdominal fat or belly fat is particularly linked to an increased risk of heart and blood vessel disease. Obviously, also carrying excess weight will put more demand on the heart because the body will require more blood supply to the tissues that will increase our heart load, possibly leading to heart failure over time. Number 8, hypertension. High blood pressure puts extra strain on the heart, and high blood pressure will exert excessive force on the arterial walls, leading to damage of the arteries over time. This excessive pressure will also make the arterial walls thick and rigid, leading to atherosclerosis, which is plaque development. The extra strain on the heart will force it to work harder to pump blood, which will lead to a thickening of the heart muscle, particularly our left ventricle, the main chamber of the heart, which supplies the oxygenated blood to the entire body. Unfortunately, the thickening of the heart will decrease the heart efficiency and increase the risk of heart failure. More so, constant high blood pressure can cause blood vessels to deform and dilate, to thin out, can create an aneurysm, that is the bulge in the blood vessel wall, and it can rupture and cause life-threatening internal bleeding. High cholesterol is number 9. Again, too much LDL, the bad cholesterol, and not enough HDL, the balance between the two, can lead to the buildup of plaque, which is causing narrowing or blocking of the arteries. As the plaque builds up, it will reduce and narrow your arteries, limiting the flow of oxygen-rich blood to the heart, and this causes a heart attack in the extreme ischemia situation. And it's also leading to a stroke when the tissue that's being deprived of the blood flow is the brain. Number 10, diabetes. Everybody knows high blood sugar damages blood vessels and nerves connected to the heart. Diabetes, unfortunately, is accompanied by obesity, hypertension, high cholesterol, and inflammation. And I've described all of these as the essential core pillars of increased risk of cardiovascular disease. Number 11, age. The older you are, the higher the risk for a heart problem and a heart event, particularly after the age of 45 for men. Number 12, sleep apnea. This sleep disorder will lead to high blood pressure, heart disease, and stroke. You think, oh, I just don't sleep very well. I just have some sleep apnea. I'm going to get a CPAP. I'll fix it. Sleep apnea is by definition repeated episodes of loss of breathing during sleep. Your breathing just stops. And unfortunately, this reduces the oxygen levels in the blood, increasing the carbon dioxide levels. This is stressing both the brain, the heart, and the cardiovascular system. Repetitive apnea episodes will activate your body's fight or flight response. It's like similar to someone choking you. The resulting chronic overactivity of your sympathetic system will lead to persistently increased heart rate, high blood pressure, both of them stressing the heart even more. It is well known that repeated episodes of low oxygen in the blood will damage the lining of our blood vessels called endothelium, which will decrease the ability of the endothelium to maintain vascular health. And this obviously, if they don't have the ability to stay healthy, will lead to plaque formation, leading to narrowing of the arteries and subsequent loss of blood flow and ischemia. Number 13, last but not least, low testosterone levels in men has been associated with an increased risk of cardiovascular disease through various and multiple mechanisms, which shows how important testosterone is. We know that low testosterone leads to an unfavorable lipid profile. It causes a higher level of LDL, which is the bad cholesterol, and it's associated with a lower level of HDL, which is the good cholesterol. This imbalance will contribute to formation of plaque and increase the risk of atherosclerosis. Testosterone in men plays a vital role in managing sugar. Therefore, low levels of testosterone can lead to insulin resistance, which is the first step towards diabetes. Testosterone in men will help regulate fat distribution. So low testosterone in men can result in increased body fat, particularly in the visceral area, or what we call belly fat. And this is known to be associated with a higher cardiovascular risk. Low testosterone in men is linked to an increased level of inflammation in the body, which contributes to cardiovascular disease by itself. Testosterone is an essential anabolic hormone. It contributes to maintaining muscle mass, including your cardiac muscle. A loss of muscle mass in general due to low testosterone can lead to decreased heart efficiency and a higher likelihood to develop heart conditions. Low testosterone can cause fatigue, depression, and decreased motivation for physical activity, which will further negatively impact your heart health. So after this prolonged discussion about the risk factors and the main contributors of heart disease in men, let's talk about signs and symptoms. How do you know that you actually have heart disease? Well, the symptoms of heart disease in men vary greatly, depending on the specific type of condition. But the most common symptoms of heart disease would be, number one, chest pain or discomfort. This also guarantees you're going to be processed really fast to the emergency room. This is also known in medical terms as angina. It might feel like pressure, squeezing, fullness, or pain in either the center, but most typical on the left side of the chest. Another symptom is shortness of breath. Sometimes there is no pain, but there is significant shortness of breath. And again, this can occur with the chest discomfort or without the chest discomfort. It may happen during physical activity or while you're at rest comfortably, lying in bed or in a chair watching TV. Any new onset of shortness of breath should be worrisome and likely a reason to call 911 if you're home alone. Heart disease can present with atypical pain. For example, you could experience pain in the neck, jaw, or throat. Or you could have pain or discomfort in the shoulder or the arm. Often pain radiating from the chest to the arm. This is much more common in men than in women. It's very typical, but sometimes it could be simply severe shoulder and left arm pain. This just comes out of nowhere, okay? Another very important symptom is fatigue. So please be aware that unusual tiredness or fatigue, particularly after exertion, can be a symptom of heart disease. So please be forewarned if it's not typical for you to feel extremely tired, whether it's after a workout or you suddenly exerted yourself doing something or you had a very stressful event and you suddenly feel extraordinarily tired, that is a bad sign. Make sure you don't get into the car to drive yourself. Perhaps it's best to take some aspirin and call 911. How about nausea and indigestion? Some men may feel a sense of indigestion or heartburn. It's not uncommon for them to ignore it and blame it on something they ate until it's too late. Again, this is a very atypical presentation, but it can have devastating consequences because it tends to be pushed aside and ignored. Oh, okay, I just ate something bad. In reality, it could be a heart attack. So pay attention if it's accompanied by fatigue, dizziness, or other symptoms, which are telling signs that you have a problem that's not digestive in nature. Dizziness or lightheadedness. If you suddenly feel faint or dizzy, this can be a sign of heart disease, an early heart attack, or a stroke. Please lie down and immediately ask for help or call 911. Sweating. Breaking out into a cold sweat without an obvious cause is a bad sign. It could be an indicator something bad is happening and it's happening fast, which puts the body in a stress mode. So ask for help. Let someone know this is happening to you. Heart palpitations. Feeling like your heart is racing, pounding, or skipping a beat is very serious. This could be a sign of a serious heart issue. So at a minimum, if this is persistent, consider being evaluated by your doctor's office the same day, urgent care, or in an emergency room, where a simple EKG can rule out a more severe diagnosis like atrial flutter, atrial fibrillation, or another severe arrhythmia, which could endanger your life. And swelling in your legs, ankles, or feet, this is a condition where the heart isn't effectively pumping the blood. It does happen over time. This doesn't happen overnight. If it does happen fast and you suddenly have a lot of swelling in your legs, this is a sign of severe heart failure. You need to go to the nearest emergency room because a viral cardiomyopathy or a toxic cardiomyopathy could be fatal and they need treatment in ICU to be reversed. So if you or someone else experiences symptoms, they may indicate a heart attack, severe chest pain, difficulty breathing, extreme discomfort in the upper body. Please seek medical attention immediately. Early detection and treatment are crucial to managing heart disease effectively. Now, these things I talked about are things you might have heard before, all these signs and symptoms. You might have already known about them. What is not widely known, which I find surprising, is the fact that erectile dysfunction, ED, can be a sign of heart disease due to the connection between the blood vessel health and cardiovascular function. Let's talk about why ED and heart disease are connected. Well, number one, both ED and heart disease share a blood vessel dysfunction. Both erectile dysfunction and heart disease involve problems with blood flow. Erectile dysfunction is often caused by reduced blood flow to the penis, resulting from narrowed or blocked blood vessels. This vascular issue can also indicate similar problems in the heart's arteries. Number two, you might have heard of the term endothelial dysfunction. It's a pretty fancy term. It means that the endothelium, which is the inner lining of all the blood vessels, is not working well. A dysfunction of the lining of the blood vessels can lead to reduced nitric oxide production. You might have heard of nitric oxide. This is essential for blood vessel dilatation. This malfunction affects blood flow, not only in the penis, but throughout the body, including the heart. You might say, well, I'll just take a little nitric oxide. Where can I buy myself some nitric oxide? Well, you cannot take nitric oxide because nitric oxide is a gas that's made on the spot by the cells that line your blood vessels. Your blood vessels go and release this little gas that's the most powerful vasodilator that we have. The guy that discovered it won the Nobel Prize for it. It's that important. These cells, the endothelial cells that line your blood vessels, require precursors like L-arginine and L-citrulline to make nitric oxide, plus other little cofactors, right? Number three, the atherosclerosis connection. Well, atherosclerosis equals plaque buildup in arteries. It can cause ED, erectile dysfunction, by reducing blood flow. Since atherosclerosis affects arteries systemically throughout the entire body, if you have poor blood flow to the penis, it can also mean you have poor blood flow to your coronary arteries, leading to heart disease. Erectile dysfunction could be your first warning that you're dealing with plaque in your heart. Number four, both erectile dysfunction and heart disease share common risk factors: high blood pressure, diabetes, obesity, smoking, and high cholesterol. It's well known that all these conditions will damage blood vessels, lead to erectile dysfunction, and cardiac health deterioration. So if you are over the age of 50, you have high blood pressure, you're overweight, you have high cholesterol, you smoke, you drink, and you don't exercise, and you wonder, oh, well, I just have a little ED, not a big deal. I'll go do some testosterone, I'll go do some other things. You could actually die of a heart attack, and this could be your first warning sign. And number five, erectile dysfunction could be an early indicator of vascular health. Since the penile arteries are smaller than the coronary arteries, they might actually show signs of dysfunction before a heart problem becomes apparent. So this makes ED, erectile dysfunction, an early warning signal for cardiovascular condition, which could save your life if you take it seriously. Recognizing erectile dysfunction as a potential sign of underlying heart disease allows us for timely intervention, allows you, the patient, to implement lifestyle changes and therefore management of cardiovascular risk factors. So if you're experiencing erectile dysfunction, and if you're a woman whose man is experiencing erectile dysfunction, please urge him to consult a healthcare provider. It could be crucial in assessing his heart health. In conclusion, heart disease is the leading cause of death in men across many countries, but it is the leading cause of death from men in the United States. What is unfortunate is that men are more likely to experience a heart attack, which could kill them, as their first symptom of coronary heart disease. And sometimes that will occur without any prior warning signs. I will end here and leave you with this statistic. Approximately 1 in 4 male deaths in the United States are attributable to heart disease. So heart disease should be top of mind for both you, the patient, you, the spouse, and us, the doctors. It should be foremost addressed and investigated for any male over 50. I will continue this topic in the next episode, so please join me next week for more discussion on other pertinent men's health issues. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.